Good day, students. Welcome back to our class. I hope you are having a good day and ready for another discussion. For today, we are going to discuss different common non-communicable diseases, their nature, causes, symptoms, and prevention. So before we start our discussion, answer the question on the slide first. When was the last time you got sick? What caused your sickness? How did you treat your sickness? So, as we have discussed last time, non-communicable diseases are illnesses which are not caused by pathogens and cannot be passed from one person to another by touching, coughing, and sneezing. This can be resolved from heredity, lifestyle, environmental factors, and other related factors. While it is normal to get sick from time to time, we should not take it for granted and let it last for a long time. It is important to know about the disease, its symptoms, and how to treat it. And that's what we're going to discuss. Come on, let's start. So the first one is allergy. So a state of hypersensitivity wherein the body reacts to food and other substances. Most allergic reaction cannot be prevented. So although it can be prevented totally, substances that cause it can be avoided. So what causes allergies? So the common allergens can be found in environment or food. So common allergens in environment, pollen, dust, mold, grass, strong odor, animal dander, feather, or smoke. Tapos food allergens naman, milk and other dairy products, eggs, peanuts, and seafoods. So how do you know if you're having allergic reaction? So the symptoms may be different from one person to another. So here are the symptoms and ways on how to reduce allergic reaction. Symptoms: running nose, sneezing, watery eyes, coughing, congested lungs, headache, hives, stuffed up feeling in the nose, ears, and chest, itchiness, nose bleeding. So ways to reduce allergic reaction. Avoid contact with allergens. Remove dust from your home or room. And follow doctor's advice and prescription. So another common non-communicable diseases is asthma. It is a chronic condition wherein a person experiences difficulty in breathing, which can be caused by poor air quality or allergic reaction. So the symptoms include dry cough, wheezing sound, tightness in the chest, difficult in breathing. So how can it be controlled? So always bring an inhaler. So there is no cure for asthma, but using an inhaler can control it from getting worse. The next one is arthritis, which is a term used to refer to many different types of joint pain. This is common to elderly but can be inherited and affected children. So people with this disease often experience pain when moving because of the swelling of the joints. They also feel still and have a hard time moving quickly. So this can be treated by physical therapy, regular exercise, and medication. Another one is the cardiovascular diseases. So these are diseases of the heart and blood vessel. So we will discuss three cardiovascular diseases which include hypertension, stroke, and heart attack. Hypertension is a cardiovascular condition caused by high pressure or tension in the arteries, such that the flow of blood against the artery walls become too much. The symptoms are headache, dizziness, nausea, chest pain, shortness of breath, and blurred vision. This can be prevented and treated by doing the following. So number one, maintain healthy weight, eat healthy foods, less salt intake, regular physical exercise, do not smoke, manage stress properly, and take medications. So another cardiovascular diseases is stroke, which is a condition in which the brain tissue suddenly died because of lack of oxygen. So immediate medical attention is needed for someone who is having a stroke. So these are the symptoms. So unexplained dizziness, numbness of facial muscles, dimness of vision or loss of vision, slurred or garbled speech, paralysis of one half of the body. And to prevent stroke from happening, here are some preventive measures. Regulate one's blood pressure at normal level. Regular exercise. Maintain health weight. Eat plenty of fruits and vegetables. Avoid fatty foods. Do not smoke. The last one is heart attack, which happens when part of the heart does not receive enough blood and the heart is not able to pump well. So the sign includes acute chest pain, shortness of breath, profuse sweating, nausea, jaw ache, pains, pains in the shoulder and arms. And to fight heart attack, a person must do the following. Eat a nutritious diet. Avoid fatty foods. Get plenty of exercise. Maintain an ideal weight. Avoid smoking. The next non-communicable disease is cancer. It is a disease in which cells grow uncontrollably, then attack and affect healthy tissues. It starts with a tumor, which is a mass of abnormal cells that become lumps. So there are two types of tumor, the benign and the malignant tumor. So benign tumor does not spread in the body, and malignant tumor spread and invade healthy tissues, cancerous. So cancer can be caused by the following: overexposure to carcinogens, unhelpful diet, unprotected exposure under the sun, smoking and secondhand smoke, drinking alcohol, lack of regular physical activity, use of prohibited drugs. So there are preventive measures to avoid or reduce the risk of getting cancer. So preventive measure, avoid unnecessary exposures to harmful chemicals. Follow a low in fat diet. Eat fruits, vegetables, and whole grain products. Avoid sun overexposure. Avoid using tobacco in any form. Avoid drinking alcohol. Regularly visit the doctor to detect cancer in its early stages. But when treating cancer, there are factors that affect the success of treatment. So, treatment of cancer. Factors that affect successful treatment of cancer. Type of cancer, location in the body, how far it has developed, patient's overall health and attitude. And these are the possible treatment for cancer. So treatment for cancer, surgery. So surgery, removal of cancerous body parts. Next one is chemotherapy. Use of a special medicine to eradicate cancer cells. So radiation, a powerful kind of treatment that kills cancer cells and shrink the size of tumor. So biological therapy, improving the body's own cancer fighting system. So the next one is diabetes, which is a disease of endocrine system that affects the body's ability to use sugar for energy. It is characterized by high sugar levels in the blood. So there are two types. Type 1 produces little or no insulin at all. Type 2, the body produces insulin but cannot use it properly. So this can be prevented when you eat helpful diet and exercise regularly. So the last one is the urinary system problem. The common urinary system problems are the UTI and kidney failure. So urinary tract infection. So infection of the urinary tract caused by microorganisms that enter the body through the urethra. It can be treated with antibiotics. So preventive measure, drink plenty of water, avoid salty foods, urinate frequently, avoid tight clothes, don't use harsh detergent in washing clothes. So kidney failure, a condition where the body is poisoned because of the inability of the kidney to filter waste products built up in the body. So people with kidney failure are advised to undergo dialysis, which is a treatment that does not or that does some of the function performed by a healthy kidney. To reduce the risk of having problems in urinary system, you must do the following. So preventive measures, drink plenty of water to help eliminate body waste, eat foods low in sugar and salt, wear comfortable pants and change your underwear every day, urinate frequently. In order to care for the body in general to prevent the occurrence of the mentioned diseases, we should do the following. Eat a healthy balanced diet, get plenty of exercise, drink lots of water every day, avoid stress, avoid alcohol consumption, avoid using tobacco, have a health examination every year. The following are the agencies that research, study, and formulate policies to prevent and control non-communicable diseases. So, World Health Organization, Global Non-Communicable Diseases Network, NCD Alliance, and Young Professional Chronic Diseases Network. So that's it for today. I hope you've learned a lot and take care for your body more. I'll see you next time. Goodbye and God bless.